My name is Rachel Ann Ops, and I am currently 34 years old. So, some random historical facts about me. I had this really horrible trend of constantly getting either strep throat or the flu every single year of elementary school, right around Valentine's Day or right around spring break. I was a trumpet player in my middle school band. I was the only girl. High school was my first ever experience with surgery. I got put under for my wisdom teeth. And here's a fun fact. I got dissolvable stitches in my mouth, and one day I could feel the stitch kind of tickling between my jaw and my cheek. So I went to the bathroom and thought it would be a fun idea to pull the stitch, and I almost simultaneously threw up and blacked out. But neither happened. But it was a horrible sensation, and I learned from then on you don't pick at stitches. I did some crazy stuff, like I went to Sturgis 2 years back to back. I worked as an official campground photographer 1 year. I have sort of become a caretaker for various family members. Last year was probably the roughest year medical-wise for my family. We had one person go through a hemorrhagic stroke, and they did survive. My dad went through 2 grand mal seizures within 6 months, and then my mom was diagnosed with cancer for the second time in her life last June. Her doctors really pushed her for genetic testing, and then they really pushed me for genetic testing, and now we're here to talk about the fact that I am a PALB2, and that's spelled P-A-L-B, and then the number 2, genetic mutation carrier. It's Saturday night. I am less than 40 hours till double mastectomy time. It's really setting in that there are moments where I just want to vomit. I'm sure part of it is just like I've never been through surgery before, and so my first big surgery is a very invasive one, removing a lot of top material here. I just kind of keep reminding myself that by this point next week I will be in a lot less pain, just trying not to panic, and I'm just trying to remind myself that this is worth it. This is worth it. So there are some 44 known genes that have been positively linked to cancer. Probably the most common known genes are BRCA1 and BRCA2, and that's BRCA and the number 1, and then BRCA and the number 2. Those genes are the most commonly connected ones to breast cancer. But in recent years, I want to say it was as recently as 2014 or 2016, they discovered PALB2. So having a PALB2 genetic mutation means that at some point my DNA is going to rebel against me, and I'm going to develop breast cancer, as well as pancreatic cancer, ovarian cancer, and if I had male anatomy, prostate cancer. My chances of breast cancer are lower than BRCA1 and BRCA2. BRCA1 and BRCA2 carry a 80 to 90% chance of breast cancer, and I sit at a 40 to 60% chance of breast cancer. And that's just via paper statistics. Now, if you look at my family history, my mother has had it twice. Her mother died of breast cancer at the age of 53, and her mother's mother, so my mom's grandmother, died at the age of 35 from breast cancer. We've also had several other family members on my mom's side get breast cancer and survive, get breast cancer and die, and one of the men on her side of the family got pancreatic cancer and died. I discovered that I am a PALB2 genetic mutation carrier by doing a blood test. It was pretty simple, as simple can be these days, in that I got a referral from my primary care who sent me to a genetic counselor. The genetic counselor then ordered the blood test, which is just a real quick blood draw over at, I went through UC Health for all my stuff. So I did a blood draw with UC Health. Basically, they ran my DNA through a bunch of sequencing. They looked for the mutations, and they found the PALB2 gene mutation in me, which my mom has. They did confirm I have one copy of the PALB2 gene mutation, which means it only came from my mom, which means my dad's side is not a carrier, and we've never suspected his side carried this. But I am also listed as a questionable genetic mutation. They didn't give me the specific gene, but there is a mutation in my DNA that is, it's in the unknown realm right now. So that means they're still studying this gene mutation. Does it positively link to any cancers? And if so, what does that mean for my future if they can positively connect it? Genetic testing is something that I think everybody who's comfortable with that idea does. Genetic testing is more specific for cancers. So they look at your DNA through a coding machine, look for mutations, tell you what these mutations mean, and then what you should do for your future. So for somebody like me who has this mutation, now I know when I turn 45, which is 5 years before the recommended age of 50, I should do pancreatic MRIs to get a baseline image and to start looking early for growths on my pancreas. It also tells me when I am in like my mid to late 50s, I should start doing either ovarian ultrasounds or just get them removed completely to lower that risk. It also means that I should be doing yearly breast mammograms as well as yearly breast MRIs. So ideally, for someone with this mutation, you should do them on a 6-month altering basis. So right now in May, I go get mammograms, and then right about October, November, I go get MRIs. Who should be getting genetic testing? Anybody who wants it. I would highly advocate it for anybody who has a familial history of cancers. You are likely the best candidate to get genetic testing to unravel potential genetic mutations that are causing your cancers. Now, not every cancer has a genetic link. There are some cancers that are environmental based, and then there are some cancers that we just have no clue what causes them yet. But at least verifying or eliminating your genetics as being the source of a cancer will either bring you relief or potentially more anxiety. But again, you have to weigh in your mind and in your world, what's the benefits versus the risks. So when I got the answers back from my genetic testing, the actions I have taken right now aren't very different than what I've done in the past. My genetic counselor is very kind. He's very patient, and my entire medical staff has told me time and time again, everything is my choice. This is my body. I can do what I want. So he laid out 3 paths before me. Path number 1, which is the path that I'm already on, is every 6 months a rotation of either a mammogram or an MRI. And it's not just a one and done with most of those. Most of the time I do get recalled for a secondary look, which is usually an ultrasound to confirm if something is a cyst or if it's something else, and what next steps are. Option number 2, do absolutely nothing. Just wait and see what your health does. That is everybody's option. You do not have to act on your health. You do not have to act on medical care. But you have to understand the consequences of not doing stuff to keep yourself healthy and prevent illnesses is the risk of getting critically ill and, of course, dying. We all kind of know how this ends. The third path, which is the path that I'm sort of pivoting to this year, is a preventative double mastectomy. By removing the tissue I have now, I will go from what I consider to be about an 80 to a 90% chance of cancer to about a 2% chance of cancer, which to me is just, why would I not? Why would I not take that? So what am I trying to get out of taking the preventative steps by doing the preventative surgery? The short answer is peace of mind. To fully understand what I've been grappling with, I'd have to take you back to 2019, literally right before the pandemic. I had switched jobs. I had no health insurance because I was in that new window, which is probably the worst feeling in the world, to be completely uninsured. And I woke up literally on the morning of my 29th birthday with a mass in my left breast. And I had the heart-sinking feeling of it's cancer. Because we're poorly taught in American school systems about our health and what other things can be. The short story is it turned out to be a benign cyst. They drained it. They said the fluid looked totally normal. No reason to test it. Nothing to be concerned about. Resume normal life. At this point in my life, I have lost count of how many cysts I have had in my chest. Every single one, even though I panic less now, I still get that what if in my mind of what if this time it's not a cyst? What if this time it actually is cancer? In 2023, when I did my first ever breast MRI, I had an absolute just guts falling out your ass feeling moment when they said they found not a cyst on my MRI, and it was something else that they needed to look at. Had to go in for a biopsy, which is definitely a heart-racking feeling, and it ended up being something called a fibroadenoma, which if you want to Google that, you can. But basically, it is a non-cancerous growth of tissue that most women get in their 30s and up through menopause, which again, I had no fucking clue you could get this. I'm also what's known as Class C, heterogeneously dense breast tissue. So that means my chest contains more fibrous tissue than it does fat. Well, what does that mean? On mammograms, fat shows up as black. Fibrous tissue, so like your ducts and just, I guess the best way to describe it is kind of rubbery feeling pieces of tissue, show up as white. Cancer on a mammogram also shows up as white. So when you have more white in your chest, it's harder for them to see cancer early, which is why I have to do the mammograms. So having all these combined, I have just felt like there's a bomb strapped to my chest. And there's an invisible timer, and I can't see the time. And I just know at some point that timer is going to run out, and the bomb's going to go off, and cancer is going to start growing. At what stage I catch it is kind of up in the air. And it's not always guaranteed that you're going to catch it in stage 1. Doesn't mean you're going to catch it in stage 4. And stage 4 cancer is no longer the death sentence it used to be. But the more cancer has grown and the more it has spread, the more intense your care is going to be, the more tissue they're going to have to remove, the more likeliness you'll go through chemotherapy, which if you are lucky enough to have never seen anyone around you go through cancer, you don't know what chemo does. You're basically pumping yourself with chemicals to kill the cancer before you die. So I would lose hair, all of my hair, like the hair on my head, the hair on my eyebrows. My nails can fall out, which a lot of people don't know of. There's just a lot of side effects with chemo. There's also a lot of side effects with radiation therapy. You get burns, you get extreme fatigue, you just feel really awful. And so knowing that keeping this tissue is the potential outcome, like knowing what I'm heading towards. For me, removing the tissue now is like a light at the end of the tunnel. Knowing that I can get rid of this, knowing I can lower my chance from super high to about 2%. And it just feels like there's a huge breath of fresh air waiting for me on the other side. Heavy. But I am not attached to my breasts in a way that I won't feel feminine without them. I still fully believe I will be a female without my breast tissue. I believe I can be fully accepted without my breast tissue. And if people can no longer accept me because I got rid of breasts that were going to kill me, then I guess I don't need them. So, surgery day will look like me probably not sleeping very well the night before, to be honest. I have to check in at 5:30 in the morning. Surgery starts at 7 a.m. Surgery should be over by roughly 9, maybe a little sooner, maybe a little later. And then I spend the first night in the hospital where the nurses are going to try to get me up and walking, get me to move my arms, show me how I can brush my own hair, make sure that I can get the basic functions down, and show me how to empty the drains, because I will have drains after the surgery because fluid is going to try to collect beneath the skin. I am opting to not do reconstructive surgery at this time, just because I want to try life flat-chested. I have felt so betrayed by my chest for the last 5 years that I feel like just not having it will give me a sense of peace and comfort. And like I said, I'm really not attached to them, in that I won't feel feminine or I won't feel like me without them. So recovery time is kind of interesting. I walked into the doctor's office both times for my general surgery and for my reconstructive surgery with a list of questions, because I need to know everything before I commit. Recovery time is 2 weeks, no reaching up over my head, so I can reach to about here. But anything higher is a no. And that's just because they want the skin that I'm going to be left with to adhere with the chest wall muscles. Otherwise, my my skin is going to be like a slip and slide for the rest of my life if it doesn't adhere properly. So we want that to heal nice and flat. I cannot pick up anything over 10 pounds for the first 2 weeks. So the first 2 weeks, the main rules are no lifting, no picking up stuff. I'm allowed to return to work whenever I feel like it, basically once I'm off the narcotics, which I have very strongly voiced my opinion on. I don't want anything opioid related because I get horrendously loopy and dizzy and feel like I'm stuck in a fog. So they're going to do their best to send me home with everything non-opioid related. And then I can drive whenever I stop taking the opioids as well. So recovery is much faster than what it used to be, because they've really got it down to a refined science. After those first 2 weeks, they will give me a list of stretching instructions, so how to regain mobility up over my head. I can start slowly picking things up that are more than 10 pounds. And then kind of after the first 4 to 6 weeks, life is normal. My doctor even said I could go jogging within the first 2 weeks, but she doesn't know me. I hate jogging now. There are a few things that you should do when it comes to your health. Let's say you go through the genetic testing, you come back positive with some sort of gene, maybe not BRCA, maybe not PALB2, but something else. Reach into your community. You'll be surprised as to who around you has the same genes. Right now, along with having a personal trainer in my phone, I have a death doula who helped me put together my paperwork. Now, I don't plan to die during surgery, but I mean, we can drop dead at any time. But I do have a death doula named Carla. She has helped me put together my death paperwork. What do I want for my body? What do I want for a funeral if I don't survive? And I also have a really cool herbalist who is making me a post-surgery care kit as well as some scar cream to help reduce scarring. So don't be afraid to reach out into your community. Find those people. And if you can't find those people, you're more than welcome to ask me. I've had people come talk to me about it, and they've started with if this is too sensitive, just tell me to fuck off. And it's like, no, I would rather educate people so they're aware that these things happen, that these genes exist, and that you do have resources in community who want to help you. So yeah, if you decide to go down this journey of genetic testing, you're more than welcome to come ask me questions. If you end up with a genetic mutation, I will help you as best as I can, but your genetic counselor will probably be the best source. Unless you have the exact same gene as me, then I will give you all the knowledge I know and lean into your community. They're here to help. Dear future me, Thank you for making the tough decision to improve our health chances going forward. This is not an easy decision. Right here, right now, I am so anxious about surgery. This is the first time in my life I've ever gone under for a big surgery. The only other time I've been put out was for my wisdom teeth, which is not nearly as invasive as having my entire chest removed and rescaped. It may be difficult, but the pain is worth it. You have a therapist if you need it. You have counselors if you need it. Your community is here waiting for you. And I just have so much endless appreciation and gratitude to everyone who has already reached out, offering help and saying, what can I do? You don't know how much that means